I had the
Keep it up like this. Yeah.
okay. I had the opportunity back in January to speak with the Cape Coral chapter of NARFE, and so I got a good heads up and a good understanding of a lot of the issues that we're talking about here today. When we're talking about healthcare, look, every modern, industrialized, developed country in the world has some form of universal health care. The majority of physicians in this country say that we need a universal single-payer health care plan. The majority of Americans want some kind of national universal health care plan. We need to stop playing around with tinkering with the system. We need to stop catering to the drug and insurance lobbies in Washington, and we need to have real universal health care now. Not 10 years from now, not 5 years from now, not 16 years from now, now. And we need representation in Washington that's willing to stand up for this. Now, Mr. Neal's plan is interesting. It's sort of the slow boat to China plan to quality healthcare, or more accurately, we might call it the slow debt plan to China. Because while we're slowly incrementalizing seniors who are about to retire or retired, and children who aren't paying anything into the system, we're going to incur bigger and bigger debts. Because one of the main problems that we have with the healthcare system in this country is runaway costs. And those costs get away from us for a couple of reasons. Now, when we talk about expanding the FEHBP, I know it's a good program. I know a lot of you are very happy with the health care that you're receiving. But it only covers right now 8 million Americans. And one of the problems that we have with health care costs is the fact that when you have a for-profit insurance system, the only way that you can guarantee profitability is to deny coverage to somebody. Now, there is a mix of insurance companies. It's a managed competition plan, if I understand it correctly, right? And some of those companies, while you're guaranteed portability, while you're guaranteed not to be denied because of a pre-existing condition, other people that may be getting coverage from those same companies don't have that. And that's one of the reasons why we can keep this program going the way it is now. And again, I don't think it's a bad program. I think it's a good program overall. But we need to make sure that every American has that same access to health care. And unfortunately, when we talk about expanding this type of program, when we talk about expanding a managed competition program, we're still going to have the same problem that the insurance companies are in it for a profit. They are basically an unnecessary middleman. Now, this isn't, I know a lot of people like to say that this is some sort of socialized medicine, but nobody is talking about making every doctor in every hospital in this country an employee of the federal government. There'll still be private practices, there will still be the mix of for-profit and non-profit hospitals that we have now. But when you're sick and you need health care, you can go to the doctor's office and you're taken care of. That's the end of it. You don't have to worry if you're on an HMO plan. You don't have to worry if you're on a PPO plan, whatever. You have a problem, you get taken care of. And until we have that guarantee for everybody, America is not going to be competitive in the global market. Our population is not going to be healthy. We're going to continue to see skyrocketing healthcare costs, which are going to take up more and more of the federal budget. We're going to have a problem with Medicare benefits eventually eating up the entire federal budget unless we come up with a way of getting everybody in the same pool. So again, I have to say that the only way that America is going to come through the other side of this healthcare crisis is with a single-payer plan or some type of universal national healthcare plan. And until we get there, everything else that we can try is just tinkering.
Thank you very much. I will tell you that we have the best healthcare system, the best quality healthcare in the world, if you happen to be either rich or you happen to have good insurance. If you don't fit into all those categories, then we have some of the worst healthcare around. People are really surprised to know that the death rate amongst newborns in the United States is higher than it is in Cuba. And I point that out simply to say that those of us that have insurance, we're very fortunate. The 45 to 47 million Americans that don't have insurance don't see the quality of health care that the rest of us do. Now, there was a study done by the Florida Hospital Association talking about the crisis that we have in health care. And when they talk about crisis, they're talking about the fact that our hospitals are operating on a profit margin of less than 0.8%. Their largest area of growth is in the uninsured. So hospitals in the next year or two in Florida, on average, will be operating in the black. In the red. They'll be losing money on operations. What that means is our safety net hospitals, Lee Memorial has problems, Naples Community Hospital has problems. Our safety net hospitals around the state and around the country are going to start closing their doors. And so this crisis that we have is a real crisis. It's taken us a long time to get here, but we're here at a crisis point. And major things have to happen. There was a study reported in the New England Journal of Medicine a few years ago talking about the cost, the overhead cost in our system. Jeff George is correct. We have an overly complex system of billing. My wife is a physician. When she was in private practice by herself, she had two people that did nothing but billing. You multiply that through the entire system, through every hospital, through every clinic, through every physician practice, you wind up with what is about 31% of the medical dollar going to this embedded overhead. In most of the industrial world, it's about 16%. And quite frankly, in the United States, it was 17% just about 30 years ago. It's gone from 17% to 31%. So let's assume that it's 14 points too much. What does that 14 points mean? I don't need to get Robert Neal to do the mathematics on this. It's almost $300 billion that arguably is being wasted because of the overhead burden that is unnecessary in our very complex system. There's another aspect of healthcare that's costing us hundreds of billions of dollars in waste, and that's defensive medicine. It's estimated that doctors perform tests, hospitals order tests, surgeries are performed that are not necessary, and that amounts to about 10 to 20% of the medical dollar. Let's assume the low end, 10%. We have a $2.3 trillion industry, so that's another $230 billion that arguably is wasted. So out of that $2.3 trillion industry that we have, probably somewhere north of $500 billion is wasted out the door. We can't keep doing that, obviously. And so how do we correct that? Well, one of the things we do is we simplify the system. There's no reason why Medicare has a billing system, Medicaid has a billing system, and then you have hundreds of insurance companies that have different complex billing systems. In this modern day of computers, there's no reason why this system can't be simplified to get that overhead burden back from 31% back to 16 or 17%. There's no reason why we can't find a way to compensate people that are injured by medical malpractice in a way differently than what we're doing. We're wasting $230 to $300 billion a year on defensive medicine. Now you think about what we could do if we had $500 billion all of a sudden back in our healthcare system. We're talking about this bailout of our economy. We're talking about $700 billion we're putting into the investment in our economy to revive it. $500 billion wasted in our system is a lot of money. And these are not my numbers. These are reported in the New England Journal of Medicine. They're reported by the Florida Hospital Association. They've been written on for years. So why doesn't anybody do something about this? The reason no one does anything about this is because the insurance industry, the trial bar lobby have a stranglehold on the key congressmen, the key senators, the key House members that sit on committees that would regulate this. Someone has to be willing to go after the insurance lobby. Someone has to be willing to go after the medical malpractice trial bar in order for us to realize $500 billion or more in potential savings. Once we do that, then the solutions become fairly clear. I think that a single payer system certainly makes sense. That doesn't mean that we eliminate insurance companies. That doesn't mean that we eliminate or have the so-called socialized medicine. It just means that we do things smarter. And so I would suggest that is the first approach. There's an old saying that when your boat is leaking, the first thing you do is you fix the leak. You don't start bailing until you fix the leak. Well, we have a tremendous leak here as much as $500 billion that could be saved. In terms of your federal employees program, I don't think the solution is to start putting everybody into that, because again, it's too complex, it's too expensive, and healthcare is too expensive. We can reduce the cost of healthcare dramatically by doing a few simple things. I would submit, or I would tell you that as a member of the United States House of Representatives, I will take on the insurance lobby, I will take on the trial bar lobby, so that you and I can realize those savings.
Thank you. And the last question that we had in our prepared portion of this is on the future of Social Security and Medicare. Passing into and out of public debate, the two largest entitlement programs, Social Security and Medicare, are vital to all generations of Americans. How do you believe we can best ensure that Social Security and Medicare continue to provide economic and health security for current and future retirees?
There are two issues here, of course. The first that I wanted to talk about very briefly is the Social Security situation. Every 2 years, every 4 years, there is a faction that's always running for office somewhere from some party that likes to terrify everybody by trying to tell them that Social Security is on the verge of bankruptcy. In a sense, this isn't true. In terms of what's actually been paid into the program, we are not really looking at the beginning of a shortfall until sometime around 2041. At that time, we are looking at not a complete bankruptcy of it, but less and less money will be available to cover the amount of retirees. For this, there's a fairly simple fix. There's a couple of very simple things that we could do. The first, which would be my least favorite thing to do, but is one possibility, is a slight increase in the payroll tax. The second, which I think is a more viable option, would be to raise the wage base, which is currently around $102,000 per year. If you make more than that, you don't pay any more into your payroll taxes. We can raise that without significantly raising benefits for that group, and we will see more money coming into the system. And then the last option that I would look at is we can also look at the possibility of maybe raising the retirement age for those born after 1980 by just 1 or 2 years. Any combination of these three steps should be more enough to shore up the system. Now, I say that the money that's paid into the system is there. The problem that we have, of course, is that we have runaway spending in Washington, and what should be a trust fund has never actually been a true trust fund in any sense of the word. So a lot of the money that you paid into Social Security has gone to the war in Iraq, it's going to the Wall Street bailout, it's going to all of these things. So this is an overall larger problem with the federal budget which we have to address. Now, getting back to the issue of health care, again, having a single payer plan where everybody is paying into it will help shore up the problems that we have now with Medicare running out of money much sooner than what we're seeing with Social Security. There is a plan that's been out there for a while. It was initially proposed by Representative John Conyers from Ohio. It's called HR 676. And essentially it is expanding Medicare coverage to every American and improving the quality of coverage. Now, Senator Saunders brought up some excellent numbers, and basically all of the savings that he's proposing are included in this plan. We can cut administrative overhead. One of the things that he didn't talk about, which I think is really important, is the fact that if we have a single payer plan, we are in a much better position to negotiate a bulk discount for the federal government, for drugs, for medical equipment, which will also be additional savings. But again, everything that we can save through cutting administrative costs, through bulk discounts, all of this is eventually going to get eaten up by the insurance companies. The trial lawyers are also a problem. The defensive medicine issue, this is also something that has to be tackled, but particularly the insurance companies. Now, I know probably most of you have been residents here for a while, and by this time you've gone through 1 or 2 hurricanes. And so you've had to deal with the insurance companies. This is a problem we've been dealing with statewide and all along the Gulf Coast. And if there was any doubt in anybody's mind, the insurance companies are not there to insure you, they're there for a profit. And this is what we need to fix.
Well, I've told you about Medicare already. Let me tell you what I believe about Social Security. I don't believe that in any way, shape, or form Social Security should be privatized. And the primary reason I don't believe it should be privatized is because I can see the vultures on Wall Street circling, waiting for this new influx of money where everybody has their own Social Security funds to invest. They're just going to steal it. And the folks who we're trying to protect, our seniors, who need an income for their life, would be at risk again. So I do not have any visions of grandeur that any day it can ever be privatized. I do, however, propose a sweeping reform that would make it really a trust program. That's what it should have been in the first place. Then it would have been stable forever and in perpetuity. But since, as Mr. George suggested, it's been rated here and rated there, we're going to have to do a little making up on it somewhere. Here's what I propose. For our children, say those born after the year 2000, I want to put them into Social Security 2. Social Security 2 would take the Social Security taxes they pay and literally save it in a savings account. Now, that savings account would be available to municipalities to improve their infrastructure. Say, for instance, we needed another bridge here in Lee County. We could go to that savings account and buy general obligation bond, borrow the money to build another bridge across the Caloosahatchee, and we could pay it back over 50 years, which is the useful life of the bridge. Meanwhile, that child who has made that investment into that savings account is going to be working all those 50 years and putting more money in the savings account. And if we will do that as a savings account for them when they retire, Social Security will be safe and secure forever and in perpetuity. Now, some good things will happen with that, some bad things will happen with that. The good things are, for our children, Social Security is fixed. Oh, let me say about the savings account, we can divide it up by congressional district. It's easy enough for them to tell, okay, the 14th congressional district here in Southwest Florida has paid so much in, and this is how much available to borrow. But you know what, if we need more than that for our bridge, there's no reason we can't go to that congressional district in Alaska. Well, they didn't build the bridge to nowhere, so they don't need the money right now. We'll borrow their money and pay them the interest that we would have paid in our own congressional district. But what that what that tends to do is keep the money here at home and close by for use by the people that pay it. Okay, now, if we move our children out of the Social Security program and put them in Social Security 2, it is going to reduce the contributions that go into the original Social Security program. So that means instead of 2041, when it starts to be struggling with not being funded properly, it'll be sooner than that. So that's the downside to this. But we'll be able to project when that would happen, and we'll be able to assess ourselves accordingly. Because remember, it's you and me that elected these people, that rated the fund, so we bear a measure of responsibility for allowing it to happen. It's you and me who elected the people that designed the fund, that didn't set it away in perpetuity. So we bear a measure of responsibility for letting it happen. So what we have to do is we have to realize that we don't want to loot the United States Treasury. We don't want to stick our hands in the pockets of our children and our grandchildren.
The issue of Social Security is one that obviously is very important, but I consider that to be one that's important for the very short-term future, not for today. We have so many pressing issues in this country: immigration reform, healthcare reform, energy independence, fixing the economy. These are things that are pressing right now today. If we don't start solving these problems today, the issue of Social Security is going to seem somewhat inconsequential when we get to it 10, 15, or 20 years from now. When we do get into Social Security, I will tell you that I am opposed to the privatization of Social Security. I was opposed to it before these current market upheavals, but when you take a look at what happens in the market, many of us have invested in, on our own in the market. And I don't know how your investments may have done on a personal level, but some of mine have gone up, some of mine have gone down. I wouldn't want my retirement to be dependent on my ability to conquer Wall Street. And so I would oppose the privatization of Social Security. But once the federal government pays back to the Social Security Trust Fund what's been borrowed from it, Social Security is in pretty good shape for the next 30, 35 years. What is not in such good shape is Medicare and Medicaid. I was talking to an audience the other day and pointing out that the largest increase in the number of bankruptcies in this country is people that are 55, 65, and older. As a matter of fact, people that are reaching the age of 85, the number of bankruptcies has quadrupled, and mostly because of health problems. An elderly person, 85-year-old, gets sick. Next thing you know, all their bills are not paid. They're not able to work part-time in a job to pay for other expenses, and they're in bankruptcy. And it's a sad state of affairs when we have 85-year-olds in this country going bankrupt because of health care. So let's talk about health care for just a moment. I talked about some of the savings that are there and how essential it is for us to go after those savings, and how those savings in the short run and in the long run will help us solve all of the health care problems that we have. The incumbent voted against requiring negotiations, competitive negotiations with the drug companies on drug costs. I don't understand why anybody would do that. As you know, the Veterans Administration has one of the best health care programs in the country. Veterans have all of their drugs taken care of. And you know what? The Veterans Administration negotiates with the drug companies, and they have the lowest drug prices that when they purchase their drugs. There's no reason why the federal government shouldn't do the same thing. The only reason they're not doing it is because members of Congress are unwilling to fight with the pharmaceutical lobby that has fed those members of Congress for so many years. And so Medicare is an interesting program, and quite frankly, spreading Medicare around to the rest of the population would be a great idea, except for the fact that right now Medicare is somewhat bankrupt also. We have to go after those savings. Medicare has a kind of an embedded overhead of about 7 or 8% when you talk about billing. Everyone, they have one single system across the country, and it's a fairly low-cost program to administer. One that certainly would be a model for the rest of the country, as long as we are reducing the cost of health care, reducing the practice of defensive medicine, and getting more money into the system. And so I think that there are solutions to health care, there are solutions to Social Security. I believe Social Security is a longer-term problem that we now have to focus on the immediate ones. The issue of immigration, I know that's not part of the question, but we have to stop the flow of illegal immigrants in this country. Whether that requires a wall, that's fine if it does. We have to stop people coming to this country legally on a visa and then overstaying their visa. We have to make sure they're identified and they're removed from the country. You remember the September 11th terrorists. Most of them came to this country legally on visas from Saudi Arabia, and they overstayed their visas. There's no reason why in this day and age we don't keep track of who comes to this country, and when their visa expires we make sure that they leave, and that we close the borders so that we don't have any more illegal immigration coming in. A major problem, one that we have to solve today. Energy independence. You know, the price of gasoline has gone down quite a bit, but that's temporary. We're spending $700 billion a year on oil from foreign countries. We have to stop that. Those are the issues that we have to focus on in the near term.
Mac, our congressman, was invited. I followed up because I had not heard from him, and I talked to his office in Washington, who then referred me to a third party to that, and they said no, he could not make it, he wouldn't be available. I then offered to let him give us a written response to these 3 questions, and I have not heard back yet. So take that into your information accordingly. Now, questions. Who has questions? I know Treva had one.
No, I had a statement, and before everybody in here panics, I just had a statement. The Social Security and the federal COLA are the same.
Right now, yeah.
Yes, they are the same, so don't everybody panic and think they're different. The other thing is, that raise is based on the Consumer Price Index. Okay, it is not subject to congressional approval right now. Therefore, when prices go up, your increase goes up. And right now, it's at 6%. It's the highest one we've had recently. But just so everybody knows. I do have a question though.
Okay, your question.
Okay, Robert, you want to change Medicare to age 60. Let me give you a perspective. I'm an ex-smoker, smoked for a lot of years. Huh? I currently have a health issue, which is COPD. Now, when I found this out and I wanted to quit smoking, guess what? Insurance companies would not pay for medicine I needed to quit smoking. They would not pay for it. What is it, sir? What's the, anyway, there was a medicine you could take, plus the patches. Health insurance companies will not pay for that. But guess what? If I got lung cancer, they pay for me to stay in the hospital and have lung surgery. Now, I'm sorry, that does not make good sense to me. I contend that one of the things that we need is we need preventive health care. We need insurance companies to pay for those preventive measures that will keep us from needing major surgery. And most of them won't do that. Just do it.
I have a question too.
Let them answer first. Answers, anybody? There's the
One of the points that I was trying to make is that we have to do things differently than we've been doing things. So, for example, the issue of preventive care. You know, right now, someone gets sick, they don't have insurance, they wait until they get really sick and they wind up in the emergency room. It costs tens of thousands of dollars to treat something. Kids lose hearing because they have an ear infection that's not treated. It would only take a $5 bottle of pills and antibiotics to do it. And so, in the very near future, what I would foresee happening is seeing a whole lot more of these types of clinics where people can go if they have no insurance and get the prescription issued by a nurse practitioner. You don't have to have a physician seeing every person, but you have to have a physician that's kind of overseeing things. But by doing that and providing more preventive care, we will reduce the cost of health care dramatically. That's something that I think we're going to start seeing in the very near future.
But the insurance company needs to cover those prescriptions.